Hello, dear editor and CGH readers. I'm Dr. Hong. I'm a gastroenterologist from Taipei Veterans General Hospital. I'm pleased to introduce our recent study entitled "Survival Rates Are Compatible After Radiofrequency Ablation or Surgery in Patients with Small Hepatocellular Carcinoma." Our study was supported by Taipei Veterans General Hospital and the National Yangming University. Surgical resection, liver transplantation, and local ablation therapies are currently regarded as potentially curative treatment modalities because the demographic data of patients undergoing radiofrequency ablation and surgical resection are frequently different. It is very complicated to evaluate the real impact of these two different modalities on outcomes. Moreover, it is also very difficult to conduct a prospective double-blind trials to compare their efficacies. To minimize confounding factors in non-randomized retrospective studies, propensity score matching analysis has been introduced to overcome potential selection bias in recent years. This study aimed to evaluate the results of patients with hepatocellular carcinoma who underwent radiofrequency ablation or surgical resection by using not only multivariate analysis but also propensity score matching analysis to mimic a randomized trial in a non-randomized retrospective cohort study. This cohort study retrospectively reviewed patients who underwent radiofrequency or surgical resection in Taipei Veterans General Hospital from 2002 to 2007. We enrolled 419 consecutive patients who fulfilled the diagnostic criteria of hepatocellular carcinoma by a double-A consensus in 2005. 119 and 229 patients received radiofrequency and surgical resection respectively. The inclusion criteria were hepatocellular carcinoma within size of 5 centimeters, no extrahepatic metastasis. Tumor number was 3 or less. Child classification or liver function were A or B. No other major disease that might complicate radiofrequency or surgical resection. The surgical resection group had younger age, a higher male to female ratio, higher prevalence of hepatitis C, low prevalence of hepatitis C virus, better liver function reserve, large tumor size than the radiofrequency ablation group. Before propensity score matching, the radiofrequency ablation group had a shorter overall survival time and a higher tumor recurrence rate than surgical resection group. After propensity score matching, the radiofrequency ablation group was comparable to surgical resection in overall survival time, but the radiofrequency ablation group still had a higher instance of tumor recurrence. Moreover, in patients with BCLC stage 0 hepatocellular carcinoma, radiofrequency ablation was as effective as surgical resection for overall survival time and total recurrence. Both multivariate analysis and propensity score matching. According to the current consensus, surgical resection was the first-line treatment of hepatocellular carcinoma. In the present study, it showed patients with small hepatocellular carcinoma had a higher rate of tumor recurrence after radiofrequency ablation than surgery. However, the overall survival rates are compatible between these two therapies. In subgroup analysis, radiofrequency ablation is as effective as surgery in patients with BCLC stage 0 hepatocellular carcinoma. Therefore, we suggest that radiofrequency ablation may be used as the first-line treatment in small hepatocellular carcinoma, especially in BCLC stage 0, if surgical resection is not feasible. Thanks for your attention.